So I'll be talking about the Affordable Health Care Act and what it is. So the act coverage is affordable to families between 100 and 400% of the poverty level, and kids can't be denied for pre-existing medical conditions anymore, and they can let young adults stay on their parents' plan, and so it makes it easier and more affordable for them to get health coverage. And then seniors keep their existing Medicare benefits, and they can choose their own doctors. And the Medicare will be strengthened, and the Medicare Trust Fund will be extended as a result of cutting waste, fraud, and abuse in the system. Not right now. Small businesses get tax credits for covering employees right now. Obamacare helps small businesses that lack the purchasing powers that large businesses have to cover their employees. The total value of tax credits available to small businesses in 2011 is more than $15.4 billion, which is an average of $800 per employee. And then Obamacare puts the people over their insurance company profits. Insurance companies can't cancel your coverage when you get sick or set lifetime coverage caps. They can't set lifetime coverage caps that leave you without health care and plans that drastically need anymore. And then insurers will have to spend 80% of premium dollars on patient care and quality improvements, or they have to provide a rebate to you. So Obamacare is not the best thing, healthcare, but it's for people of lower class and poverty. So it's only their only option, so it's good for them.
As my partner previously stated, we do not like universal health care systems because for years, America has been doing perfectly fine without Obamacare. And now Obama is trying to make everyone who doesn't have insurance have to get insurance, and if they don't have insurance, they will get fined. It's not our fault. Next thing you know, they are going to make everyone have Obamacare insurance and make the nation a single-payer government, which means that everyone has the same health insurance that is managed by the government, rather than different insurance companies. And the government pays for all health care costs, which means more taxes than we already have. I mean, sure, Obamacare helps the elderly and people who can't take care of themselves, but they are doing nothing the same exact thing any other health insurance can do at a lower price, like Blue Cross, Shield, Humana, Progressive, and plenty of others. So why should we pay more for, not right now, for Obamacare, which is an insurance that most of us don't want or don't need? Also, a lot of people have jobs that provide insurance for them, so why would we pay higher taxes for insurance that we aren't even using, which is wasting money that could be used to start lowering debt in our country instead? Yes?
Earlier you said that Americans didn't want Obamacare, and Obamacare has helped 16 million people. How would that work if they didn't want it or need it?
It's lowering costs. So, if you have a job and your job provides, most jobs provided insurance, then why would you use Obamacare?
But what if your job doesn't provide insurance?
Then there are other things that you do.
I know, and Obamacare is one of them, and it's helped 16 million people.
Okay. I'm also going to talk about what private care insurance is now. Private care insurance are very, very expensive and can take a really long time to be seen by them. There are not a lot of private care insurances that are listed in the USA, but there are a lot listed in other countries like the UK. But that is probably because they are a single-payer government, and that is what Obamacare is trying to make this country, which means that if Obamacare succeeds, we will either have to use Obamacare or switch to private insurances, which I recently stated are very, very, very expensive. It can take a really long time to be seen by. Not right now. So that means that we should not do Obamacare. And also, America was perfectly fine before we had to have an insurance. And it will still be perfectly fine if we go back to not having to have an insurance. And also, Obamacare does not care about us.